project has been funded. This project has been funded by the Mauritius Research and Innovation Council under the special call for proposal in view of addressing the issues which has been generated by the COVID-19 pandemic. So currently today we have a presentation by one of the awardees, Mr. Ganesha Morgan from Healthlog. He will be presenting us his solution on an online medical diary. So he will give us all the details. So without much ado, I'll hand over to my executive director, Professor Tishan Baran, for a few introductory words. Prof.
Thank you, Vikram. Very good afternoon to all, and welcome to this webinar. As Vikram just highlighted, this project emanates from the special call on COVID-19. And just to recall that we had approved the 26 proposals. In fact, we received 252 proposals, and from the 250 proposals, 26 projects were approved. And the MRIC was requested to fund these 26 projects to the tune of 17.2 million rupees, which it did. And to date, from the 26 projects, 19 have already been completed, and seven are still ongoing, waiting completion in the near future. And a number of these projects have been already disseminated through webinars. So today we have another project which is being disseminated, Healthlog. This is a cloud-based health record management platform set up by the applicants. And today they're going to show us what they have achieved in terms of deliverables with regards to the project objectives. And most probably one question that immediately comes before the results are disseminated is how will this system be applied? Will there be any collaborative endeavors with the authorities? Because it comes in a very timely moment where health issues are quite pertinent these days with regards to the COVID-19, and also with a number of people attained with COVID-19, the health record management is an essential element of the system. So let us hear from the applicants and from this and from those who have completed the projects, and we'll be asking a few questions through the system, and Vikram will be managing this online. So thank you very much, and I leave the floor to Mr. Morgan for his presentation.
Thank you, Prof. Thank you. So, Ganesha, the floor is yours. So, you have some, let's say, 30 minutes to present your project, and then we will take the question and answers.
Hello, everyone. Thank you, Vikram. Thank you, Dr. Baran. I am Ganesha Morgan from Augment Company Limited, a software development company in Mauritius. Last year, for the special call for proposal for the COVID-19 launched by the MRIC, we proposed the Healthlog project because it is something that I have personal experience, something where we can improve in the country. So there's a problem right now in Mauritius, in several places of the world. There is incomplete and inaccessible medical records, and people can't disseminate their medical reports to their medical practitioners easily. And especially with the COVID situation, we've seen that people who have previous health conditions, they are more vulnerable to the disease. And sometimes and most of the time, we can't relay this information to their caregiver in due time and don't benefit from proper care as such. So our solution is a cloud-based health record management platform for users to maintain a centralized medical diary giving access to health institutions and practitioners to rapidly view the user's medical condition and history, so as to get better diagnostics. The platform is called Healthlog. It is available on healthlog.mu. And for this project, we spend a lot of time to understand the medical industry and how we can give a proper solution. So our objective was to bring innovation in the healthcare industry, bring collaboration. Because health data is very confidential, we spend a lot of time to understand the legal aspect of for holding the data. And we want the platform to evolve as per technology is evolving. The benefits of the platform will be it will provide accurate, up-to-date, and complete information about patients at point of care. It will enable quick access to patient records for more coordinated, efficient care. It enables securely sharing electronic information between patients and clinicians. It will improve diagnostics for patients, and it will facilitate interaction between healthcare providers and patients. The market size for the electronic health record systems is, according to some research that we did online, is approximately $29.1 billion, which is quite big. And our product is as such. We have a patient wallet application, which is a mobile application where the project will have his health records on his mobile device. There will be a point of care application which will be used by healthcare providers to log diagnostics. And all this lie on a concept algorithm that we built, which will allow patients to grant access to their record when required, so that not everybody can see every patient's report. It's only a specific user will be granted access for that. And of course, from the over data we'll be collecting, we will be providing analytics. So what is our concept algorithm? Our concept algorithm, it is an algorithm that allows each time a doctor, a medical practitioner wants to see a patient record, he will send a request and the patient has to approve that request, except on this exceptional condition cases where the administrator will have to grant access. With control of access, you decide which healthcare provider you want to access your record. There's emergency access, like I said, for administrator to grant access, and you can also see who has access your record. But the first part of our project was to create a medical report exchange format for the data. First thing, the patient identity on the platform is pseudonymized. That is, you don't see the name of a patient, you don't get to see the NIC number of a patient, you only see a generated pseudonym of a patient. The next thing that we use is the ICD-11 codes created and managed by the World Health Organization. ICD-11 is going to be introduced to the world in January 2022. A lot of countries are already starting to use it. And we integrated that, and we have ICD-11 API on our servers, and that's freely available for people to consult at any point in time. I'll show you later in the demo. How our data is structured, we have a record header which will record the ID of diagnostics, an ID of a patient, which only the system can identify and nobody else. You get a timestamp for the date of a transaction, an ID of a person, healthcare provider, and the consent ID from the patient. We will also include in the body, that is the diagnostics, we get the ICD code 11, and the diagnostic has a free text, which the doctor can write any free text concerning the diagnostics, and the prescription ID. The prescription ID will be linked to the medication for the patient, and this part will come in a later phase for the project. And finally, we'll be having a record footer, which will be hash key of all the data collected in that record. It is similar to the blockchain infrastructure. So what is the ICD-11? It's a global standard for health data, clinical documentation, and statistical aggregation. It will come in force in January 2022. So our tech stack, what technology we'll be using, we have a PHP library called Data Vaccinator, what we use for the consent algorithm. It is a PHP application. We have an API server that gives all access to all the data from our databases. For the mobile application, we've used Ionic and Angular. We have a MySQL database for all the data, and we use Graph database for analytics. So our business model is a platform business model, which is a digital platform for healthcare data. It's free usage to patients and a paid subscription for healthcare institution providers through our point of care application. The second phase of application will be also launching insurance plans and claim integrations, because since we'll be using a centralized format for health needs like ICD-11, we can help insurance companies to log and classify claims, medical claims. Our key differentiators is that we will be having our own identity management and consent algorithm. It's a decentralized database. Why is it a decentralized database? It is all the point of cares, we will have their own database, and through an API access, we will be feeding our own our analytics, and all the different instances will be communicating among themselves. We have some competition in the market. It's different types of EHR or electronic health record system already exist, but our difference is that ours is motion made first thing, but also our tech stack is lean and less bulky than the different one mentioned on the screen. So this is our technology roadmap. We have a consent algorithm that's created, the point of care application is created, the patient wallet is created, and the analytic forms exist already. The second phase that we'll be using will be the e-prescription for medication, and then we'll be doing the health plan, which includes the insurance for insurance companies, and health plus infrastructure with something else we'll be launching in the future. So conclusion is like Healthlog project is envisaged to be enable better continuity of care, secure and convenient health data records management, better diagnosis of the diseases, reduction in patient revisits and event prevention of medical errors, better affordability, optimal information exchange to support better health outcomes, better decision support system, and thus eventually facilitating improvement in the reforms of treatments and care of public health at whole level. So as next slide, I'll start showing you different screens before going to the demo. This is the coding standards from ICD-11, which we made available on our servers. This is a screenshot of a core Healthlog core application where we can see the different patient records and diagnostics, which we call encounters. This is the same screen, but for encounters, and the screen here where we can create a diagnostic. This is my wallets application for a patient to see all their past encounters. And this is an analytics from our database. This is a point of care application, our point of care application. This will be built for customized for every point of care for healthcare provider. It's a very lean application, and it generates an API which can be which we will feed our database, central database. So I'll go directly into our application. So this is the ICD-11 classification system that we put on our servers. You can see, you can check it out. It's on coding.healthlog.mu. You can check for any type of disease online. You just type the name, it will give you all the different types of diseases. You can check it. And this is the code. This is the 1B13.z is the ICD-11 code. And that's referenced by the World Health Organization. And this is the code that we use for all our diagnostics on the Healthlog platform. Similarly, there's a screen here, which is called on the same link, you will get that. On this link, for example, if you want to get information on COVID-19, you just tap COVID-19 and you see all the different types of disease and classification that the WHO have identified for COVID-19. That identified, you can get more details, and it tells you the different post coordination that you see. This database is the database that we'll be using in our um, application. I'll log in on our application. This will be available. This is available on code.healthlog.mu. And this application, what we do, we just log in. We can create a patient, receive a patient number. You see that the barcode that's generated for the patient, it's based on it's a hash key that's generated one time for each and every patient. This ID can be printed, inserted on a bracelet, and appears on the wallet application for doctors to identify the patient. To create an encounter, you create an encounter, you create admin. You get your patient ID. This field, unfortunately, I can't display it on right now. You need to scan a barcode scanner or a mobile phone to scan the ID. Once you scan the ID, automatically it gives you the patient ID. But the thing here, as you can see, we don't see who is the patient for this record. We only see a number, and this helps us handle the confidentiality of the data. And that's what we call the pseudonymized data. For the coding, for example, you go to a doctor, you want to tell the doctor that you have a certain disease, we will tell you, we will check you up and type a few things. For example, if someone is having tuberculosis, you just type tuberculosis. You will see there's different type of tuberculosis, and the doctor will choose which one he sees and can add it test, and this will be saved. So it's as simple as that to create a diagnostics on the systems. But the thing is, once all this information are collected, we will be able to do some further analysis, like for example, on analytics encounter. We will see the different types of diseases. You see the Kaposi sarcoma, I just created this one. You will see, you have different to see by period as well. And we can have all sorts of different reports in the future. And then if you log in as a patient, I've created a sample patient, you log in, you will see the record. This is the record for a patient called Jennifer. And but the Jennifer that you see here is a pseudonymized name. It's not forcibly the name of a person. When you create your record, you can put any name, but your record will be unique. So you see that's the ICD-11 code. That's the description of the thing code, and you can see the details, the name of the doctor and everything. And every time you go to a doctor, you just give him you just have to scan your ID, and you will get that information. For example, this person has been identified with COVID-19 and is experiencing post-COVID-19 condition. All this will be seen. And then, sorry, this is the main application that will be used by point of care application. This application is more visually pleasing because it will be used by healthcare providers. You can select existing patient. You just select that. As you will see again, you don't see the name of a patient, you see a number. You can just select. This is pre-filled. If the person is already the person filling is already part of the provider, this information will be pre-filled. This you will get the consent ID from the person from the mobile application. Automatically, it will appear here like a long list of number. You put the ICD code here, but unfortunately, we don't have how to link it yet. And then you click next. You saved. You see the record will be published, and that record, as you will see, it's already encrypted, and nobody else beside the person will be able to see that record. The person can also see a list of patients for that healthcare institution only, not for all the institutions, just for itself for the time being. And of course, we have insight where we can see the analytics for the platform. Yeah, and that's so. Yeah, so that's all for our platform. So we are waiting a bit fast on that. Yep. So Kiatimo, you asked which technologies we use for the platform. For this, for ICD database, we use PHP, and we got access from WHO. For the application here, this application, we use PHP and MySQL mostly and some JavaScripting. For this application, this is mostly JavaScript application linked to the MySQL database. Is that answered?
Right. Thank you, Ganesha. Thank you. You have already taken care of the question from Mrs. Moipat. Any other questions? If you would like to intervene directly, please let me know. Raise your hands. We can allow you to ask your question directly, or you can still type it on Q&A. So, Ganesha, while waiting for other to raise their questions, so this application is already up and running. Let's say I am a medical doctor. I would like to use it. How do I go about it?
First thing, if the doctor is an individual doctor, but he works for himself, they have to contact us and create. We will create the login, a specific login for them. We don't want them to create their login themselves. It's preferable for us to create the login, and once we create the login, we can start to use it instantly. Because the patient, they don't create their login themselves. It's the first time we go to the doctor, their login will be created then. So yeah, you just need to create the doctor's login and give it to the doctor.
Okay. And is this a paid service? How does
for the patient? For a patient, it is a completely free service. For the doctors, the price varies depending on the type of doctor. If you're working solo or for his healthcare institution, it depends on the size of the user.
Okay, so I'm a patient, so I can register. Where do I go? Healthlog.mu?
No, this is what we did not. We're not letting patients to register on the platform themselves. They have to go see a doctor that is using the platform, and the doctor will create the first record, and from that they will get their login. In that way, we ensure that all the people who register on the platform are actually not fictitious people, like they actually exist, and a doctor is validating their existence.
Okay. And I guess the doctor can put in all the test results, the scans, etc. on this database.
No. Right now, if you see in the Healthlog port of care application, we do allow putting images and different types of the DICOM images for X-ray and stuff. But we will disable this feature for the time being. We want to keep it just to identify the type of diseases according to the ICD-11's classification for cases in Mauritius. Because once we get that, we will be different from our competitors. Our competitors, they give you everything, but they can't give you analytics on what type of, how many people right now have tuberculosis or some other type of disease, and what type of prescription have been given for that type of disease. We don't have this type of platform right now in Mauritius, but our platform can give us that, and we want to stick to that totally, and not be a document management system for documents.
All right. Okay. Thank you. Yes, we have Mr. Ramdat. Would you like to ask your question directly, Mr. Ramdat, or I can read the. Says, can a doctor import a CSV into the system, and where is the secure data saved? Do you have a doctor backup of their own data? Ganesha?
No, doctors can't upload CSV. CSV of patient records, I'm presuming, right? What type of CSV are you talking about? Patient records?
Mr. Ramnat, you can have allowed you.
Yes.
Yes.
Good morning. Yes, Ganesha, very nice presentation. I was just wondering if a doctor can upload their own list of patients, for example?
No,
Go through you.
actually, it's a centralized database. If someone goes to see Dr. X, Dr. is 100 patient, Dr. Y will also have access to that same database.
Ah, okay.
Yeah, it's one database for every doctor in the country.
Okay, very nice.
Because in this way, we can share information easily among doctors and different medical practitioners.
Okay. And what about the privacy of the patient, for example? Do they need to consent before the doctor uploads their data?
Yes, they need for a doctor to put information on a client or to view that information, they need to scan that ID that I showed previously.
Yeah, the hash key.
This the hash key that is generated with identity. We need to scan that, and only this way we can access the data. And also, like I said, it's a pseudonymized data. Even if I get to see that, for example, for this record is for Jennifer. For Jennifer, I don't know. This is not confidential information because I don't know who Jennifer is, and Jennifer can be there are thousands of Jennifer in Mauritius and millions of Jennifer in the world. So Jennifer is not a confidential record in that system. You get my point?
Yeah, sure. Yeah, thanks.
Yeah.
Okay, any other questions? No?
So
Yeah.
for the backup part, the platform is deployed on a cloud server, and we do have daily backups of the server.
All right. So if nobody else has any questions, I'd like to thank Ganesha for this presentation. And if in the meantime anybody has any questions about this presentation, please feel free to write to us, contact@mric.mu. So with this, we end this presentation, and we will make it available on our social media. And I invite you to go to get in contact with Ganesha should you have any further queries. Thank you very much, Ganesha. Thank you, everybody, for attending, and wish you a very nice afternoon.
Thanks.
Bye-bye.
Thanks you too. Bye.